At 11 o'clock with the very latest on the coronavirus outbreak, Governor Lamont says we are on track to safely reopen on that target date of May 20th, which is just 13 days away. Hi, everyone, and thanks for joining us tonight at 11. I'm Erin Connolly.
Hi, everybody. I'm Mark Zinni. We want to start right now with a look at the latest numbers for you. More than 31,000 people have now tested positive for COVID-19. The death toll here now stands at over 2,700 people, and just under 1,400 patients are being treated right now in hospitals throughout the state. Some good news here. That is a drop from yesterday.
Now, in order to reopen, there are 7 metrics that need to be achieved, and today we got an update on each one.
Channel 3 Eyewitness News reporter Matthew Campbell is live right now with more details on this for us. Matthew?
Yes, Mark and Aaron, it is mixed. We're doing well in some areas and then not well in others. We learned today, though, even if we don't fully meet each of those 7 metrics, we are still moving forward on May 20th.
Consider this color-coded chart Connecticut's report card for reopening the state. Weeks ago, the criteria was laid out. We need to see 14 days of declines in hospitalizations. Even though a 12-day streak was broken on Tuesday, Governor Lamont had encouraging stats.
We're down about 30% from the peak in terms of hospitalizations.
We're not doing well in testing. The state wants to double the current amount of tests to 42,000 a week, and the governor says it may take longer than a month to get there.
I think you're going to see real progress on our testing capacity and implementation over the next 2 weeks and over the next 6 weeks.
The voluntary contact tracing went live today. The state has done this before for measles and mumps, but for the coronavirus, it's gone high-tech. The state partnered with Microsoft and 20 local health departments. Lamont expects 700 contact tracers soon.
I think we're off to a good start there. We have a way to go.
As the tragic death toll mounts in nursing homes, a big stride has been made for the high-risk groups. This includes first responders, at-risk urban communities, direct care workers, and correction staff. They no longer need to get a doctor's note to get a test.
It's those most congested areas where you can have flare-ups and the potential for a resurgence of COVID. So this is why it's really important that we continue to focus on our nursing homes.
Hospital space is an area where the state is succeeding. There's so much space, some overflow hospitals are being taken down.
Right now we have about 40% of our capacity, which is good. If we get closer to 20%, we rethink some of our openings and some of our priorities.
Having enough protective gear is another important metric. The state wants to have a 30-day supply, and Lamont says the stockpile is strong except for gowns. But a big shipment on Saturday will help.
We got supply and demand are beginning to match up.
The final criteria for reopening is letting businesses know what they'll need to do upon reopening. Many owners haven't heard a thing, and time is ticking. The governor will make the rules public tomorrow.
You have a couple of weeks to prepare, and if that's not time, don't open up. You know, May 20th is just a date that you can open it up, not a day that you should open up until you're ready.
So there's still a lot of work to do, and you saw how this is being measured from red to green. We asked, what if we're not completely in the green by May 20th? This is what the governor said.
Look, if we're a little off on 1 or 2, we'll make a judgment on that. But I feel very confident that we're moving in the right direction. May 20th is a good date.
So with about a week and a half left, we'll continue to stay on top of this, especially when it comes to the testing. For now, live above the newsroom, Matthew Campbell, Channel 13 News.
All right, Matthew, a lot of good information.